Yeah, I guess I have a question. You're saying we cannot at all indicate that they would need some future care, even though we did so I just want to give you more information. We did do a reevaluation just recently, about a month ago, three weeks to a month ago, and they do show that they have pain in certain areas. Most areas have resolved, but there's still certain areas that they do have pain only when they're at work.
Okay, let me just be hardcore black and white, okay?
Okay.
How can somebody who has not reached MMI, how can you give them an impairment rating? You can't, right?
Yeah, I understand.
Work with me. I'm trying to get to some points here.
Okay, you can't.
Okay, you can't. Now, so if the person is at MMI, if there is no MMI, no impairment rating, in other words, the person's now remember, I'm going black and white to make this clear. So there's no MMI, no impairment rating. There's only two other options that exist. You're still treating them and expecting a better result. That's one option. Well, if that's the case, it's not going to court right now. They're still getting treatment. The other option is they're normal. Those are the only two options that are available when you look at this black and white. The only way that person, you can recommend the need for future care is if there has been a determination, if they're still getting care. Remember, if they're still getting care, they're not at MMI, and you're not giving a deposition and it's not going to court because they're still getting care. The case isn't over, in other words. So that's what should be happening if the person had not reached MMI. They should still be getting care. Now, if they've reached MMI, and they're either 100% normal and the case is not going to court, or they've reached MMI and there's an impairment rate. Let's say you did not do the impairment rate. Well, they could still need care. You just didn't do the impairment rating, but they've reached MMI. But you cannot have it both ways. You cannot have a patient who is either continuing to get care and yet go to court, or and still expecting a better outcome, subjectively and objectively. You can't have that and it be going to court and you're trying to settle the case because the case is not over. They're still trying to improve. Or the patient is normal. Well, if they're normal, they don't need further care. You shouldn't be suggesting it if they've gotten back to normal. So the only way this person should be getting the need for future care is if you're still expecting a greater response, they have not reached MMI, or they have, you just haven't given it an impairment rating. So they're done with getting care, you just didn't give it an impairment rating. And that's essentially what happened in this case, Joe. The patient reached MMI, you just didn't get it an impairment rating. Is that not right?
I guess so. I guess I don't understand because when I'm looking at the AMA guidelines and I look at the categories, they don't fit into even that first category. So that's where I'm kind of...
Hold your thought with a particular injury. Let's go to MMI and impairment ratings and just stick with that. Don't try to bottleneck a particular impairment rating with a particular injury. Let's just talk about the topic of MMI, impairment rating, and the need for future care.
Okay.
How can the person need future care if they're either normal? You would agree if they're normal, they don't need future care and they're released, right?
Yeah.
Okay. Can you also agree that if you're still expecting a better outcome, in other words, they have not reached MMI, can you see that the case is not over?
Yes.
And you would also not be going to court.
Right. Yeah, because we've been treating you.
Right. So the only other option that exists for you to suggest that needs future care is either they're at MMI, you just didn't call it MMI, and you didn't give it an impairment rating, or the person is still under care and they're expected to get better. But you can't have a normal patient, normal meaning you did not define it as MMI. Because if you didn't define it as MMI and impairment rating, you have a normal patient. It's one or the other. You can't have a normal patient and say, oh yeah, but they need future care. Can you see how stupid that is?
I understand that.
Okay. That's just not thinking straight when you know, and by the way, I'm not talking about you individually, Joe. I'm just talking about, I've had doctors that do that. They go, oh, the patient's normal, but they're going to need periodic care, for 3 months or 6 months or the rest of their life. I'm like, you can't say that if they're normal. That's incongruent. It's too easy for an attorney to go, to put your back against the wall and make you look stupid. So in this particular case, it was essentially that case was at MMI, and the person was still having problems in the remodel phase, right?
Yes.
And that's kind of how you left it, and that's how the case ended, and that's kind of where you're at, and now it's headed to court, right?
Yes.
Okay.
Quick question, just to make sure I got clarification on what you said earlier. If you release somebody at MMI and there is no impairment rating, then there should be nothing in your narrative about need for future care. Is that correct?
Okay, that's a good, common, fair question. And I kind of tried to answer that earlier, but let me be real clear.
Make sure I heard it right.
Okay, let me just be real clear. If the patient is still under care and there's no MMI, then there's no need for an impairment rating, and there's no need for any lawsuit to be going on. So that's one scenario. Second scenario is, let's say the patient you stopped care, they're at MMI, but let's say you did not call it, and here's really the big issue, is the chiropractor who's not trained, but then he calls it MMI, but he doesn't give it an impairment rating, but then he tries to say that there's a need for future care. That's the big problem that I'm seeing. Now, on top of that, another problem that I see is then the chiropractor says, but you'll only need care for 6 months. I'm like, how can you don't, there's no MMI, there's no impairment rating. What justification at all can you say that they need care, but then only for 6 months? That's stupid. That's just, there's no logic to that argument at all. So all I'm saying is, to get the need for future care, what do you have to have? You have to have the case done with, number one. Are they out of care? And have they gone past, and I already said, you're safer to give MMI. You already know the definition of MMI. It's past 12 months, 2 re-exam periods, no subjective or objective proven. But you don't have to wait 12 months. You can use your professional opinion. And I say the least amount that I would want to go is in the remodel phase. 2 re-exams within the remodel phase with no subjective or objective improvements. I feel safe because there's no more collagen synthesis and everything's stabilizing. I said that's the earliest I'd ever logically want to give my opinion as to MMI. You can give MMI in the repair phase. You can give it in the inflammation phase, but it's not going to be very logical in most situations. You're not going to have the logic to back it up, unless the example I gave, unless there was an amputation and the arm's ripped off and you're never going to retrieve the arm again. Well, yeah, I can give the impairment rating within 24 hours of the inflammation phase. Okay, so because the arm's not coming back. So. Anyway, having said that, if you let's say you stop care, but the person still has symptoms. Now remember, if they don't have subjective or objective symptoms, there's no need for future care. There has to be some type of restriction or limitation, either subjectively or objectively. So you can't say they need future care if you don't have it, because that means they're normal. Really what it typically means is you just didn't do the sensitivity tests that were needed to find it. That's typically what the problem is. So if you're at MMI, you didn't call it MMI, you didn't do an impairment rating, but let's say you stop care, care's over, can you say that the person needs future care? Well, only if you can go back and say they were at MMI, then you can, and they still had the subjective or objective findings. Then you can say, yeah, there's a need for future care because there's no chance of healing. That's called MMI. And they still have subjective and objective findings. But then for you to call it MMI, it had to have stabilized. It's not getting any better by definition. So you can do that, but you have to have the subjective and objective findings. And if you have the subjective and objective findings, then you definitely should be able to get an impairment rating out. One leads to the other. But typically what happens is the doctor doesn't do the MMI, he doesn't understand the 3 phases of healing, doesn't understand impairment ratings, and then he'll say, yeah, the person is going to need some type of ongoing care. Well, that's called crazy. There's no justification or rationalization for that at all. Does that make sense, Dave?
Yeah, you should have ongoing problems at MMI. You need to have some kind of an impairment rating before you start saying the person needs future care.
Well, the key is MMI. That's the key to say, the key is you're done with care. In other words, you can call it, by definition, MMI. They're done with care. That's what MMI is. They're done with care. There's no, in your opinion, no likelihood of any subjective or objective improvements at this point. They're done with care. But they still have either subjective or objective findings. Well, you can give that person the need for future care.
Okay.
Because they're past them, they're stabilized with subjective and objective findings. And the only thing that I'm going to add to that is, if that's what you do have, you should be able to get the impairment rating. You just don't know how to do it. You didn't do the sensitivity testing to get the impairment rating. But in all likelihood, you do have. You just didn't do it. But there's no way that you should ever say somebody has the need for future care, and they're either one, not in MMI, in other words, there's still a chance for them to heal and get better, or number two, there's no subjective or objective biomarkers. Then there's no way in hell you can say there's any need for future care. Does that make sense, Dave?
Yep.
Now, Dave, you know how easy it is to find subjective and objective findings with sensitivity testing that's subjective and 100% objective, don't you?
Yeah, you just have to ask the right questions and then do overpressure testing.
And you got to know what to do. You got to know what to test and what are sensitivity tests. Yeah. So now you could look back and go, well, yeah, I can easily come back and go, yeah, they're at MMI. Let me go ahead and do a few of these tests that I didn't do that were more sensitive that I just didn't know to do. Now, I'm not going to say that in a deposition or jury, but that's really what happened is you just didn't know to do them. Go do those tests, get that data, and then call it MMI. Ask the attorney, say, hey, request an impairment rating. Take that data, put it into an impairment rating, and now you have the total objective reasoning, high third-party trust to establish the need for future care, which is the single greatest financial injury award for soft tissue spinal injury.